Hi, everybody. Dr. Debunk here again. It's been a while since I said it, but my real name is Dr. Martin Falopino. I'm a family practitioner of 40 years, almost. My passion's always been health and wellness, what we're trying to call optimal health training and education. Doctors are basically disease treaters and drug pushers, which it's not too bad if you're broken with disease, but people want to know what it takes to be healthy. And since I've watched people be unhealthy and die for 40 years, well, then live the opposite of why everybody dies. And then you'll live to be 95 to 105. And that's the point of Dr. Debunk. There's a lot of bad information out there. So Dr. Debunk, I created him to debunk medical myths, garbage, and crap spread by doctors and other health professionals. Medical science is about the treatment of disease. Human health science is about the treatment of human health. But that encompasses at least 12 fields, as I've mentioned, 12 scientific fields. So even though doctors have great training to understand and dig into these 12 fields, we don't. We're just licensed drug pushers. So debunk is my way of combating that. And so today I'm going to talk about estrogen therapy because it just endlessly keeps up. The medical community has been shifting around for decades on this topic. And right now they're shifting back to this bad place of trying to say that estrogen has a relationship to breast cancer. Lie, debunk. There is not one scientific study that was ever done correctly to show that they could analyze this. Not one that ever showed a relationship between postmenopausal women taking estrogen and breast cancer or any cancer. It's a bald-faced lie. They have it in for estrogen. Ladies, they're trying to take it away from you. This is a terrible trend where they're going. They're making these BS studies that are so badly done. They're making a study to get the outcome they want. And the outcome they want is that any kind of estrogen in menopause will increase your chances of breast cancer. It is a lie. There's no science. There's no medical studies. The studies they're doing, I call them stack studies. They're making this study to get the outcome they want. And they're lab studies, a lot of them. And so I'm doing it because it's just absurd. We'll get to that later. So it works like this. The human body is a hormone machine. And the major hormones go like this. Thyroid hormone is the most powerful hormone determining your mental and physical perception of energy. Testosterone is the mental motivation hormone. It's the physical strength hormone. It has to do with growing cycles too. And for both men and women, just men need a lot more, just like women need a lot more estrogen. Estrogen is the dominant female hormone, along with progesterone, that makes you retain female characteristics, both mentally and physically. When women are low in estrogen, every one of them will tell you the world is crooked. It's not straight. Their emotional makeup is psycho. Husbands hate it when women are low in estrogen. Anyway, progesterone is related there. It has functions. It's raw material for brain chemistry. So men even make a pinch of testosterone, progesterone probably. It must come from our adrenal glands. It has to do with brain chemistry. Growth hormone has to do with health and wellness. It has to do with the regrowing cycles of our cells, maintaining our cell integrity. These are the dominant hormones. And so the human body is a machine. And the machine has a certain amount of programmed life built into it. And so every organ in your body will last so long. It has a genetic base programming that will determine. And that's pretty universally 100 to 105 years old. Mm-hmm. But then the way we live modifies that, both our genetic structure. Our life modifies our genetic structure, unfortunately more in a bad way than a good way. But also our life will be chipping away at the potential. So, for example, the thyroid gland will make so much thyroid hormone over the course of your life, and then it's done. The factory can't make any more. But we see redundancies, so probably a healthy person that had no genetic issues probably can make 130, 140 years of thyroid. So you'll be dead from something else. And every organ is that way. The human heart will beat 2.3 billion times. And so if you stay in shape and exercise and have a lower resting heart rate than everybody else that's fat and out of shape, oh, America, it theoretically it would take about 130 years to get to 2.3 billion beats, and then your heart couldn't beat anymore. Everything is that way. And the point is, modern society, technology is killing us. It's not making us better. Does technology have the potential to make us better? Yeah. But the net result is technology is killing us for so many reasons. It's not benefiting mankind the way they want. The technology now, the belief in it's like a god. It's postmodernism, which I despise. So if you're a postmodernist, just turn it off, turn me off now, because you're disgusting in your beliefs that there's no God, there's no truth, there's no absolute. Selfishness is the ultimate goal, you know. But postmodernism is fueled by technology. And so, anyway, that's as political as I'll get. But it could be good. I'm trying to use it for good, but and many people are. But unfortunately, other people, government people, and rich people, they want to use it just to control more than anything, not for our benefit. Okay, so the problem is the human body, based on how you live, will run out of hormones at different rates, and it's getting worse every generation. My generation didn't have hormone problems till the 60s, late 60s, early 70s. My dad, his generation, they never ran out of hormones. My dad was 92, demented out of his mind, and he could still get an erection, and he tried to hump the housekeeper every day. Because once you're demented, that's all that's left. Sorry, excuse me, but yeah, the housekeeper we had, she was the lady that took care of him. She was a big tough woman, and she just swat him away. It was funny. She thought it was funny too. But the point is, when women run out of estrogen, they will start to become masculinized. Their brain will not work. There'll be emotional wrecks. They'll have sweating episodes in the bed. They'll sweat up to bed at night. They'll have hot flashes all day. It's because they're running out of a hormone that's so essential for female characteristics mentally and physically. And men make a pinch of estrogen too, for various reasons. And the point is, because we're living unhealthy, women are running out of estrogen at incredibly young ages. It is common for me to have women that I see that are in their late 30s going through premenopausal stuff, you know, and it gets in the 40s. These birth control pills are masking it, but it's a big deal. And so, well, since hormones aren't drugs and they're natural, because now we can make all hormones artificially, synthetically, but they're natural. It doesn't matter how you make a hormone or where you get it from. What matters is it the same structure as what your body makes. So estradiol is the dominant hormone, and you can make estriol from estradiol. There's three kinds of hormone estrogens, one for pregnancy, two for normal. So estriol and estradiol. And so we always supplement with estradiol. I mean, you can take estriol too. I don't think it's necessary, but anyway. But how they make them is irrelevant, though most of it's made, I think, from plant-based. But plant estrogens, phytoestrogens, don't work in women. They just don't. And so, because if you think about it, so the word natural or organic doesn't apply to hormones. That's one principle you take. What natural hormones means, bioidentical hormones means, it means, is it the same chemical structure as what your body makes? Because they got like 6 progesterone drugs that supposedly imitate progesterone, but they're nasty drugs, every one of them. They're not progesterone. Women need to take progesterone if they're low. Women need to take estrogen if you're low. And and you can supplement either with patches or creams, or I like the sublingual route, which I'll tell you in this video how to do. It's the most inexpensive. And that's, anyway. And so think about it, the only real natural source of estrogen is from another woman. So you could suck the estrogen out of your girlfriend, but she's not going to like you. And men, same thing. So, but it doesn't matter. It's easily made. It's bioidentical. And that's the term. And you can look up, most of you listening to many of you know about the bioidentical hormone replacement field. So see, doctors have leaned towards drug type hormone therapies, which sucks. And then bioidentical is just what I said. So that's kind of an intro to how this all works for all hormones. But I'm going to focus on estrogen today. Because women, I'm in a cycle, women coming in, getting scared by their doctor, some other specialist who doesn't know anything, says, oh my gosh, you're going to die. You're going to get cancer tomorrow if you keep taking estrogen. Again, there is not one study that's done correctly. And so let me get right into that. Why do I say that? There's been 10,000 studies on estrogen. There's been a while ago, I don't know, 15 years ago, there was about 40 studies on estrogen replacement and its relationship to breast cancer. And we're talking about causing cancer. Let me get into that, not treating it. And 35 studies show no relationship, and a few showed maybe. There was this big world study done that showed a small incidence in a percentage of breast cancers based on estrogen replacement therapy. But that study wasn't done correctly either. So let me get right to that. So what does it mean to do a correct study? Well, if you're going to study if there's a relationship between a natural substance and it's somehow becoming unnatural and bad and causing cancer, let me back up. What's happened here is two things. Causing cancer and treating cancer have been mixed together. It's been mashed together by doctors, which is absurd and ridiculous. So most of the studies are being done now showing that estrogen will increase the growth rate of cancer, that it will spread faster. I'm not sure I believe that's true. I'm going to do a big research review. I'm going to look at every single study ever done on this to see if they really have proven that that's true. Because that's what they're doing now for breast cancer and like 50% of other cancers. I don't know if that's totally accurate. 50% might be more. They want to neuter you, women and men. They want to take away men's testosterone, take away estrogen, and neuter you because they'll say you have a better chance of survival because it will slow down the growth of cancer. So is that true? I don't think so. And here's why. Estrogen is vital for normal metabolic and physiologic reactions in the human body. And if you take it away, you are screwing up your immune system. You're screwing up your heart. You're screwing up every organ in your body. And so how do you know that effect is much worse than the effect, which I believe will be minor, if anything, on estrogen? In other words, on cancer. Estrogen, if you take it away, it'll slow down the growth rate. But if you take away estrogen, is the growth rate accelerated because you're losing the effect of estrogen and its immune system's ability? Your immune system is trying to kill cancer if you get it, any kind of cancer. So that's a big problem. Have they ever studied it? Not that I've ever seen. No studies. Why would they do that? Because they got 5 drugs that can neuter you. So that's money. Because remember, I've talked about this. The whole drug world, the whole high-end medical world, Harvard, David, Stanford, it's all about money. It's all about the studies showing that people need more drugs, so the drug companies make more money, and then Harvard and David and all the big universities get more money too. It's all driven by money. I mean, come on, all of you that have lived a long time. America's a capitalistic society. The whole world is. It's money, money, money. If you want to know why things go there, it's just where's the money going? And that's okay. I can't change that system. I don't care. If the drug companies did good stuff, I don't care. If they're rich, fine. But they're not doing good things. Drugs are good when used correctly. And I've talked about this. I just don't like the way they are using them. So anyway, back on topic. So treatment has nothing to do with causing cancer, but that's the big focus of the research. And they're just magically jumping from, well, and let's just say it's true. Let's say there is an increase in the growth rate of your cancer based on estrogen levels. The more you have, the worse it gets, the faster the growth. Okay, what does that have to do with causing breast cancer? None, nothing, zero. So to do a study, you would have to do this. And then this is going to be end of part 1, and I'll do part 2 in a little bit. To prove that there's a relationship between taking estrogen, so you have a higher than normal, than menopausal level. Not normal, but menopausal, typical. To prove that, you would have to do studies showing 3 things. And this has never been done one time in the history of medicine. You would have to take a group of people. You could take 100 women. 100 women in menopause from 50 to 70 years old. Check their blood levels of estrogen. Document their symptoms and lifestyles very precisely. But then what they've never done is jam a 3-inch needle into their leg, take a tissue sample, and measure the estrogen in the tissues. And ideally, you'd want to do some different tissues. And so you could do this with animal studies first. And so you'd have to do a tissue level of estrogen, a blood level, and a symptom level, and a lifestyle analysis. And then look at what that data shows. And then go compare that to women that are getting breast cancer, but also then compare it to women up here that are supplementing with estrogen in menopause, and see if there's a relationship. Do you see that the women who are supplementing are having more cancers? And how much are they supplementing? What are their levels? See, if I want to, I can make a study and I can target women doing estrogen replacement, especially ones that are taking too much, having too high. And I could stack the data to show, oh yeah, look at this. These higher blood levels and these women taking this much, they have a 10% higher rate of breast cancer. But I can stack the data to show that. But here's the big kicker. They have never done tissue analysis. We don't even know what normal optimal is. So you have optimal levels of hormones, normal for the average person in menopause. Then you have levels of deficiency down here. We don't know what optimal is. So how do you know what too much is? If you don't know where optimal is, you can see what averages are, but then you can see women that supplement feel so much better. And the levels are so very different. And we have ideas, if you do this long enough, and I've been doing it 30 years, you start to see, I've done 1,000 estrogen blood tests in the last 30 years. So the point is, if you don't have a standard of what's normal and then optimal, then you don't know what too much is, because by definition, you're saying that it's the women that have too much estrogen increase their risk of getting breast cancer, that somehow too much estrogen causes breast cancer, which is really almost impossible when you do thousands of blood tests. Because anyway, so my point is, that's never been done once. I've combed the data in the past. There's no studies that have ever done that. So they talk so boldly that this connection is absolute. If you take estrogen in menopause, you're increasing your risk. They act like you're going to die. You're going to get diagnosed with breast cancer in a month if you've been on estrogen. It's bold-faced lying BS. These people just make it up. And the only motive I can find is that they can just keep making new drugs to artificially treat menopause. The treatment of menopause, symptoms in menopause, hot flashes, mood swings, emotional masculinization, it's estrogen. It fixes it every time. Every time it fixes it. Well, not every time, I'm sure. And so then it would be too much, but they don't know what too much is. Now, doctors like me get a pretty good idea because we do it every day, And there's a lot more to this of why there is no causative connection between estrogen replacement and breast cancer, because they've never done the studies. They do these crap studies. And I got sidetracked. So the point is, to me, since it's all about money, so 15 years ago, what did they start doing with women in menopause with bad symptoms, emotional mood swings? Oh, we'll put you on antidepressants. And they've been making a ton of money putting women in menopause on antidepressants. They're not depressed. They don't have any hormones. Come on. It's absurd. And now they have a new drug that can somehow affect sweat glands. I don't know how it works, but women take it and then they stop sweating at night in bed. That's absurd. This medicine is strong enough to wreck a normal body function, sweat production. What else is it wrecking? See, that's a problem with these drugs that shut down normal metabolic and physiologic reactions. They're screwing other stuff up too. These PPI drugs, proton pump inhibitors, pantoprazole and omeprazole and all these ones you can buy them over the counter. We're seeing catastrophic effects when people take them for over a decade. I'm seeing it. Studies are talking, but they've made billions and billions and billions. So just take them like candy. So to me, that's the only motive I can understand here of why they would do this. They have targeted estrogen now, and they're going after it. So that's it for part one. I'll do part two in a minute to get into the nitty gritty of how to take estrogen, what I do and why, and how it all works. That's it. Thanks for watching. I'm Dr. Debunk.